You're watching CTOM TV. Knowledge is power.
So now I want to talk about surgery.
Okay.
We have three more amazing new developments.
Okay.
So probably the biggest development in surgery, and I think in brain tumors, has been this company, NICO Myriad. And you're quite aware of them, or NICO Incorporated. Great bunch of guys. I think they deserve the Nobel Prize personally for what they've done. And I've had no problem writing letters to the Nobel Prize and telling them that.
No, good for you.
They really have knocked it out of the park. So what they've done is they looked at all of the problems with traditional craniotomy surgery techniques.
As you were saying earlier, one of the people who started this company was a brain surgeon. What was his?
Yeah, one of them, neurologist, and I think the guy that actually invented the device, it was just a mechanic or something. He just, I think he got the idea from a toothbrush or something like that, but he came up with this incredible thing. Very inventive minds, and just a great company. This company's done a lot to help people, but it's radically changed surgery. So as you know, we have this problem with glioblastoma multiforme, is it has these tentacles, and you can't really get in there without removing a lot of tissue.
Right.
So one of the solutions to that is something called LIT, laser interstitial thermal therapy. And this is where they insert these microfiber, they drill a little hole in your head, and they insert these little microfibers into the bed of the tumor. And then they turn them on, and it heats up the tumor from the inside and kills it. Now, the biggest problem with LIT, and a lot of Canadian hospitals have invested in the LIT technology. It's great for epilepsy. It's great for stroke victims and so on, for moving tissue. But when you have a tumor, you want to get everything out, because there's going to be stem cells and there's going to be features in the microenvironment that can convert, like exosomes, that can convert other cells into tumors. And so the more of the tumor you take out, the better it is.
Right.
So when you're using LIT, it's a very non-invasive process. You're getting in there, you're able to access these deep tumors, but unfortunately you're not removing the tumor material.
Right.
And as we now know, the studies have shown that with the LIT technology, your survival is about the same as getting a craniotomy, where you get it cut out.
Oh. So it's less invasive and you have a speedier recovery from the surgery, but it's not actually providing you more benefit.
No, because you're leaving part of the tumor.
Right.
Right. Even if it's dead, you don't know how many of those cells survived.
Right. So it's good for epileptics, stroke survivors, but not so much for brain
like
tumor.
No.
Okay.
Yeah. So.
But that's not the NICO tool. That's something else entirely.
We'll talk about that in a second. But first, I have to tell you what the problems with a craniotomy are.
Okay.
When you get a craniotomy, they cut a big piece of your skull, and then they have to go in there and dig through the tissue to the base of the tumor, and then pull the tumor out. And it's going to have these finger-like projections. So it's a very invasive process, and they have to cut their way through the brain, and they have to go through blood vessels and nerve cells, and you're inevitably going to lose some brain function. It's a big problem, so typically neurosurgeons will balance the two effects. Also, the tools that they use to cauterize the blood vessels from bleeding are heat-based. And so they heat up the area too, and that can damage tissues too.
So you're saying doctors have to decide between how much of the tumor do we want to get out
and
how much brain function do we want to leave. Right.
And that's the big problem.
So a similar concern with the LIT, that there's almost certainly tumor left in.
Yes.
And it'll regrow.
Exactly.
And be back raised.
And then also, when you're getting a craniotomy, they got to give you blood pressure lowering drugs, because otherwise your blood pressure will just push your brain right out of your skull. So, they can't get a good sense of what's going to bleed.
Oh,
so you get out of surgery, the stitches are all in there, they cauterize these blood vessels, and then all of a sudden you start bleeding. And so because of that, they have to keep you in for observation for a while. So you have a high chance of bleeding from a craniotomy.
And it is a fairly lengthy recovery.
And it is a fairly lengthy recovery, and you lose brain function. You lose material. And it's just you're doing multiple passes into this surgical area. You're bringing in God knows what, You're constly going back and forth.
I'm assuming it's a pretty sterile environment.
Of course it is,
that I understand.
but air is not sterile.
Right.
You're just you're going in and out so many times, and that's the problem.
Okay. So
So the NICO Myriad, they came up with a brilliant solution. They call it the brain path, but it's all based on something called the Myriad tool. And what this tool is, it looks like an electric toothbrush, but it has a straw in the middle. And so the straw has this cutting head that is internalized in the straw. So it doesn't use heat to suck out the tumor or cut it out or anything. It uses this rotating little head that's encased in a straw. Flexible straw, they can bend it around, it's really thin. And then it also sucks the tumor out through the middle of the straw and they collect it. Brilliant tool, because now what they do is they've created this process called corridor surgery, where they have these, what they do is they map out the brain. And this is the brain path system, is they map out the brain and they find out where your sulcans are. And so the sulcans are these convoluted folds. So in order to increase the surface area of your brain, you have all of these convoluted folds. So what they do is they map out where these convoluted folds are. They find one that's closest to the tumor, and then they insert this plastic device in. It's called the corridor, and that separates, the material in the sulcans all the way down to the tumor. And then they stick the NICO Myriad tool inside of that corridor so it doesn't bang into anything, and they can suck out the tumor that way. And so a couple of benefits, because it doesn't use heat, and it doesn't have a big chopping head that's outside of the, it's got an encased chopping head.
It's not like a big scalpel. Like
No,
with a
exactly.
craniotomy.
Because of that, they can work really close to nerve bundles and blood vessels that are very sensitive, that surgeons wouldn't really go there. And so often they also have this material on the tubes, the corridors, that is it's very fine. It's got a fine surface, so it's able to just slide right by big blood vessels and nerves and so on. And so they can just push these nerve bundles and blood vessels out of the way. In fact, when I went to their training seminar, I was sitting with a neurosurgeon, a prominent neurosurgeon from Texas. And he was we were watching these, I was sitting next to him and we were talking about it. And he said, we're watching this surgery, in real time, because that's
right
obviously what it is, right?
Yeah.
And he said, he's gotten to the so-and-so and so-and-so. He'll never get past that. It's impossible. And the doctor who was giving the presentation just says, and what we do with this is we just push down a little bit and the nerve pops right out of the way and goes right around it. And there was just gasps in the room. They were just like, I didn't know you could do that.
Oh, that must have been exciting for them to see.
It
Holy
was.
cow.
And he's like, wow, I never thought of that. You just push it out of the way. You can't do that with a scalpel. Well, of course not, because they've developed this plastic that is non-porous, and nothing sticks to it. It's just like slippery surface. Yeah. And so because of that, they're able to go literally almost anywhere. They can even go in their brainstem with this tool, and you just have a tiny little incision, and you're out the next day.
Wow.
So if you think your tumor is resectable, or you're about to go for surgery, call NICO. Get the brain path. Go to a brain path hospital. And a lot of hospitals across the world have brain path trained surgeons these days.
We might have one in Canada.
We have a few now.
We have a few now?
We have one in New West too.
in New West.
recruit. Yeah.
Excellent. So BC and Ontario.
I think they're probably elsewhere. Yeah, they're probably elsewhere. I don't know all the places, but if you go to NICO Myriad and you click on their map, they'll talk about all the participating centers.
The point is, do not settle
No.
for standard craniotomy
Yeah.
or lit.
Yes. Get the NICO brain path.
Do what you need to do for something like that. And because if what you're saying is one of the main factors that indicates how long you'll live if you have glioblastoma is how much of the tumor they can get out.
Exactly.
Here's this
the
tool
resection, the extent of resection.
Yeah.
This is going to change everything,
No
and it really
doubt.
does.
With
It really
it's
has
such a
made
rapid recovery, so few.
Exactly.
Yeah.
It's
Wow.
just there's no reason not to do it.
Well.
And plus, you get the sample, so you can do molecular testing on it. It freezes the sample.
Oh wow.
Yeah.
So that's handy
Yeah.
because then you can make sure you're getting the right treatment after your surgery.
Totally.
Thank you for watching CTOM TV. Subscribe below and stay informed.